HIV is a topic that too often remains in the background of our conversations, yet it's a reality affecting millions of people worldwide. According to recent estimates, more than 38 million individuals are currently living with HIV. What's more striking is that many do not even realize they have it until the virus has already compromised their immune system. Early detection is not just important, it's life-saving. Recognizing the early signs of HIV, getting tested promptly, and seeking immediate treatment can mean the difference between a healthy, long life and severe illness. Today, we'll look at real-life facts about HIV, the earliest symptoms you shouldn't ignore, and the practical solutions you need to act fast and protect both yourself and those you care about. Let's begin by understanding what HIV is. HIV stands for Human Immunodeficiency Virus. This virus works by attacking your immune system, specifically targeting CD4 cells, also known as T cells, which are essential for your body's ability to ward off infections. Over time, if left untreated, HIV can destroy so many of these cells that your body becomes unable to fight off even common illnesses. When this happens, HIV progresses to its most severe stage, AIDS, or acquired immunodeficiency syndrome. At this point, the immune system is extremely weak, and the risk for serious infections and certain cancers increases dramatically. However, here's some good news. With early diagnosis and modern treatment, people with HIV can live long, healthy, and active lives. The earliest stage of HIV infection is called acute HIV infection. This typically occurs 2 to 4 weeks after exposure to the virus. During this time, most people experience symptoms that are often mistaken for the flu or other mild illnesses. That's why it's so important to know what to look for. Let's break down the 10 early signs of HIV you should never ignore. First, fever. This is often the very first symptom people notice. Your body temperature may rise to anywhere between 99.5 and 102 degrees Fahrenheit. Fevers are sometimes accompanied by chills or intense night sweats. While a fever can mean many things, if it's persistent and you have other risk factors, it's worth paying attention to. Second, swollen lymph nodes. Your lymph nodes are part of your immune system, and when they swell, especially in the neck, armpits, or groin, it's a sign that your body is fighting hard against infection. Swollen glands that don't go away or are unusually tender can be an early indicator of HIV. Third, extreme fatigue. We all get tired, but this isn't your regular kind of tiredness. People describe it as a deep, long-lasting exhaustion that doesn't go away with rest. If you find yourself unable to shake off this kind of fatigue, it's time to take it seriously. Fourth, a persistent sore throat. Unlike the common cold, this sore throat lingers and doesn't respond to typical remedies. If you have a sore throat that just won't heal, it's a sign your body is dealing with something more serious. Fifth, skin rash. Early HIV infection can cause red or purple spots on the skin. These rashes may be itchy or painful, and often appear on the face, torso, or arms. Skin changes are often overlooked, but they can be one of the earliest clues. Sixth, joint and muscle pain. The aches are similar to those you might experience with the flu, but they occur without other cold symptoms. Persistent discomfort in your joints and muscles shouldn't be dismissed. Seventh, ongoing headaches. These are not your usual headaches. They're persistent, pressure-like, and sometimes severe. If headaches continue for several days without relief, it's worth checking in with a healthcare professional. Eighth, mouth sores or white patches. Painful or recurring sores can appear on the tongue, throat, or inside your cheeks. These can sometimes be mistaken for canker sores, but if they keep coming back, it's time to investigate further. Ninth, digestive issues. Ongoing nausea, diarrhea, or stomach cramps that don't improve with standard treatments may be a sign of early HIV infection. Persistent digestive problems should never be ignored. And 10th, unexplained weight loss. If you're losing weight without trying, especially if this is accompanied by other symptoms mentioned above, it's a significant red flag. If you notice any combination of these symptoms, especially after a potential exposure to HIV, it's crucial to act fast. Here's what you should do. Step 1. Get tested immediately. Early testing is the most effective way to protect your health and the health of others. You can visit a local clinic, use an FDA-approved home testing kit, or check out community health centers, many of which offer free or low-cost testing. Some rapid tests can give you results in as little as 20 minutes. Don't let fear or stigma hold you back. Knowledge is your best defense. Step 2. Start treatment right away if your test is positive. Modern antiretroviral therapy, or ART, can reduce the amount of virus in your body to undetectable levels. This keeps your immune system strong and drastically reduces the risk of passing HIV to others. Early treatment is more effective, leads to better health outcomes, and allows you to live a full life. Step 3. Protect yourself and others. This means using protection during intimate contact, knowing your status, and encouraging your partners to get tested as well. Open communication about health is one of the most powerful tools in stopping the spread of HIV. Step 4. Stay calm and take control. A diagnosis of HIV is not a death sentence. With today's advances in medicine, people with HIV can expect to live long, fulfilling lives. Support is available, and you are not alone. Now, let's address a common concern. Can you afford HIV treatment? The answer is yes. There are programs in place to ensure that everyone has access to care. The Ryan White HIV/AIDS program provides free or reduced-cost medical care and medications for people living with HIV. Many states have assistance programs to help cover costs for doctor visits and prescriptions. Community clinics often offer free counseling, testing, and ongoing support. Don't let financial concerns stop you from getting the help you need. At SaverFinds.com, we're committed to helping you protect both your health and your finances. Our website features clear, practical guides, free wellness checklists, and updates on affordable healthcare services. We're here to keep you informed and empowered every step of the way. Remember, HIV doesn't always shout. It whispers. Sometimes the signs are subtle, but your awareness can make all the difference. The earlier you know, the better your chances of living a long, healthy life. No fear, just knowledge, courage, and smart decisions. For more helpful tips on health, fitness, beauty, technology, and more, always visit SaverFinds.com. We're here to help you make smarter choices, save money, and stay ahead of the trends. Don't forget to subscribe to our YouTube channel and follow us on Facebook, Instagram, and TikTok. You can find the correct links directly on our website at SaverFinds.com. Stay aware, stay strong, and stay informed.